We have had a program supported by Open Institute, enhancing social accountability and public participation for an inclusive governance. So we had a mapping exercise for all health institutions as well as education institutions in Kilifi County. That was last year. And for this year, we did a budget analysis. This is because we found some of the data when we were doing the mapping exercise to be a bit questionable. Now we are looking into the status of the infrastructure of these whole health facilities as well as the education facilities in the county. And then we were also concerned on how many people actually are being served under one health facility. So we went ahead and did a budget analysis where we identified some issues, where we did a comparison of the Controller of Budgets reports as well as the auditor report as well as the budget document that the county actually has, and found out that there's some data that is actually questionable. You get to see that there is, from the reports, it is reported that there is a health facility or even an education facility that is actually 80% complete, but when you go to the ground you get to see that it's not there, or it's at let's say 20%. So due to these things, we got to actually have a push to look further, and that is when we now went to the community, did community engagement forums in Kilifi County, and then we got to actually get the community views as well as collect more data on the same. Now, some of the things that we got to see is that I'll give example and in context of Kilifi County, an example of Mrimamkulu dispensary, which is in Kaloleni ward, where it has been incomplete for the past 8 years. Now, the funny thing is that almost every year, there's a budget allocation being put in place for this dispensary. But again, it has remained stalled and stalled and stalled for all these years. Until now, it is still stalled. There is another health facility in Ganze, known as Vitengeni Dispensary, where the nurses in that dispensary are actually being forced to use stones and firewood to actually boil water for mothers who are from delivering their babies. So we are looking into all these contexts in Kilifi County, and we get to question and ask ourselves, is it that these budgets or these funds being put for the health facilities, are they not enough? Or is it that there is no goodwill from the county government or the implementers of this budget? Or is it that the county assembly is not doing the oversight work as it is supposed to be? So there are many things that we actually found out in the county, not forgetting the Gambra dispensary, where we actually got to see that women had to carry torches whenever they're going to actually seek medical services during the night. Simply means there's no electricity in this facility. So these are things that came out. The issue of understaffing, the issue of lack of medicinal drugs in these all health facilities is a question that we keep on asking ourselves. Now, we went further during the budget analysis to see actually how the health sector is funded, and we got to note that sometimes these health facilities get to have funding, but again, the funding is actually taken away to another project when it comes to something like the supplementary budget. And at the end of it all, some of these funds being put in place also can actually not be accounted for. So does it mean that the county is actually spending money that is supposed to go to these health facilities? That's another question that we actually remain with as the Youth Assembly in Kilifi. But again, from all this work, we decided to actually equip the community with more information for them to actually engage the county, and mostly when it comes to matters of public participation. Now, as we speak in Kilifi County, there is a high turn-up of community members attending these public participation forums, which is a good thing for the county. At least whenever the county is consolidating and putting together these budget documents, it simply means that there are views from the communities that are going to be considered and put in place. It's a new beginning for the county.